Omar Shakir. I'm a cataract and retina surgeon in Greenwich, Connecticut. I started my practice 3 years ago, and I'm excited to share with you how I transitioned to office-based surgery. I transitioned to office-based surgery to have more ownership of the technology, protocols, and methods of doing surgery. When I was taking cases to my ambulatory surgery center, aside from showing up to do surgery, I had very little influence in the end-to-end process. I knew that I could provide better care if I had control over every piece of the puzzle: the equipment, instruments, lens choices, patient flow, anesthesia, and the overall patient experience. For example, I can provide the safest environment possible because I'm meticulous about the different aspects of sterilization. In my IOR suite, you won't find instruments sitting open ahead of time because that imposes a significant risk. Instead, they're brought directly from the autoclave right onto the back table for surgery. Because I can control details like that, I'm 100% more comfortable doing office-based surgery and the safety with it. I would say it parallels, if not surpasses, that of an ambulatory surgery center. Owning the entire process allows me to maximize my surgical time and revenue. Freedom of scheduling allows us to increase efficiency and case volume. Our average turnaround time for cataract cases went from 45 minutes at the ASC to 15 minutes in my office. We don't have a backlog of cases to get through. There's no more lost time traveling from clinic to surgery, and we gain additional reimbursements from owning the different aspects of this procedure. Our patients love coming to my practice because it's more convenient, it's familiar, it's a comforting environment. At every touch point, from consultation through post-op, patients are seeing the same staff that they're already familiar with. They're so much more relaxed on the day of surgery, and light oral sedation is sufficient enough to keep these patients calm and comfortable, but also alert enough to follow my commands. The safest way to perform surgery is when the patient's awake and comfortable. One of the biggest fears for patients is not the surgery itself, it's usually around anesthesia. The thought of an IV or fasting before surgery causes anxiety. Patients are relieved when they explain that we don't need an IV here. They can eat the morning of surgery, there's no fee for anesthesia, and the time spent in the operating room is only 25 minutes. All of these factors add value for the patient and results in higher satisfaction. I worked with IOR partners to implement office-based surgery, and a critical aspect of their service was training our existing staff, so there was no need to hire a new team of surgical cases. My staff loves being a part of the entire patient journey. Being a part of the surgical experience has made my staff feel more empowered, with a greater connection to patients, and it provides additional opportunities within the practice. Our patients benefit when the staff finds more meaning and purpose in a new service like office-based surgery, which helps contribute to the success of the entire operation.
First and foremost, the faces that they're seeing when they're checking in for their very first appointment and the faces that they're seeing when they're getting their initial workups are all the same faces that they're seeing on surgical day. So it helps them feel a lot more at ease.
I feel that I can directly impact their experience by being with them at every step of the way. They see me when they come in for their first appointment. They're going to see me as a guiding light when they're going through the surgery, which they're really nervous for.
Office-based surgery provides a huge opportunity for cataract surgeons to gain more control over surgery. When surgeons retain control, it's better for them, their patients, and their staff.